Welcome to the Using Healthy People 2020 to Achieve Your Goals, Implementation, Action, and New Tools webinar. During our webinar, you will hear about a number of Healthy People-related activities, ways that you can use Healthy People and the tools available to you to achieve your goals. I will share with you an overview of Healthy People 2020, including your ability to access it online. Carter Blakey will present how you can access the latest data, trends, and tools you can use. You will also hear from her about how to learn from the work of other communities and connect with others with similar interests. Barbara Lehman will illustrate how the county and city health officials are using Healthy People. Before we head into our interactive question and answer session with you and the other webinar attendees, I will highlight key proven practices and lessons learned from our Healthy People 2020 implementation efforts. So what is Healthy People? Often called a roadmap for nationwide health promotion and disease prevention efforts, Healthy People is about understanding where we are now and taking informed action to get where we want to go over a 10-year period. It provides science-based national objectives for improving the health of the nation, engages a network of multidisciplinary, multi-sectoral stakeholders at all levels, creates a comprehensive strategic framework for health promotion and disease prevention issues, and includes specific measurable objectives with targets to be achieved by the year 2020. Healthy People calls for the tracking of data-driven measures and outcomes that monitor our nation's progress over time, allowing us to see trends and motivate, inform, and focus action. Since its inception, it has served as a guide for our national public health, disease prevention, and health promotion efforts. Healthy People is used in a multitude of ways. Whether you're a health official, work group coordinator, national membership organization, business, health professional, or researcher, there's something in Healthy People for you. Consider Healthy People as a menu from which you can choose a la carte items for your needs. It's used as a tool for measuring program performance, a framework for program planning and development, a goal-setting and agenda-building platform, a foundation for teaching public health courses, benchmarks for comparing state and local data, and a national agenda for forging partnerships, both traditional and innovative. Healthy People is the longest-running disease prevention and health promotion plan in the nation. It's been supported by each administration since its inception in 1979. In addition, it served as the model for disease prevention and health promotion plans for other countries, including Egypt, Israel, Japan, Korea, and Uruguay. Healthy People 2020 is guided by a vision, mission, and overarching goals. The overarching Healthy People goals for the decade are to attain high-quality, longer lives free of preventable disease, disability, injury, and premature death, achieve health equity, eliminate disparities, and improve the health of all groups, create social and physical environments that promote good health for all, promote quality of life, healthy development, and healthy behaviors across all life stages. Each of Healthy People's 1,200 objectives were developed with each of these overarching goals in mind. You can visit healthypeople.gov to find out more about Healthy People's vision and mission. Healthy People 2020 covers 42 disease prevention and health promotion topic areas. There are several new topic areas in 2020. These are noted in red and include topic areas such as adolescent health, early middle childhood, and older adults. There's no expectation to use all of Healthy People's 1,200 objectives. Users can select from any one or more of the objectives that are relevant for their population. Leading health indicators are a good starting point. The Healthy People 2020 Leading Health Indicators were released in 2011. Referred to as the LHIs, the leading health indicators are 12 specific health issues that are recognized as major influences on the public's health, are linked to specific Healthy People 2020 objectives, and represent major determinants of health across the life stages. Each of the LHIs has been selected to communicate high-priority health issues and actions that can be taken to address them. While great strides have been made in public health, including increased life expectancy at birth and decreased rates of death from coronary heart disease and stroke, public health challenges remain and significant health disparities exist. Healthy People 2020 Leading Health Indicators place renewed emphasis on overcoming these challenges as we track progress over the course of the decade. The indicators will be used to assess the health of the nation, facilitate collaboration across sectors, and motivate action at the national, state, and community levels to improve the health of the U.S. population. The LHIs are designed to motivate action at all levels, sectors, and to improve the health of the entire population. When we launched Healthy People 2020, we recognized the need for comprehensive, online system to keep the components of Healthy People 2020 organized and easily accessible for our stakeholders. On December 3, 2010, Healthy People 2020 and its new online presence were released. Developed with the user in mind, at healthypeople.gov, one can access the Healthy People 2020 vision, mission, overarching goals, leading health indicators, topic areas, objectives, and interventions by topic area, join the Healthy People Consortium, register to attend a free educational webinar, and sign up to receive Healthy People news. In a departure from previous decades during which objectives were revised only at mid-decade, Healthy People 2020 objectives will now be updated throughout the decade. This allows for HHS and its stakeholders to capture and take stock of progress and changes more dynamically. Individuals can access online the most current Healthy People 2020 objectives and data as they are updated throughout the decade. Once you're on the Healthy People website, you can visit any of the topic areas in which you may be interested. After you've selected a topic area of your choice, you can access topic-specific information and emerging issues in the overview, objectives and data, and view clinical recommendations, evidence-based interventions, and links to consumer health information. For example, perhaps you're interested in tobacco issues. After selecting the tobacco use topic, you would see this page featuring the overview, objectives, and interventions and resources tab. To familiarize you with how to find what you need, I'll be highlighting different parts of an objective. By selecting the Objectives tab, you can view the specific objectives, data, and targets in that topic area. Each Healthy People 2020 objective has several elements. Each objective has a number designation. The capital letters refer to the abbreviation for the topic area, and number following the dash refers to the number objective it is in the topic area. For example, this is TU-1, Tobacco Use Topic Area's first objective. There is overall language for each objective which articulates the desired action. For example, for TU-1, the objective is to reduce tobacco use by adults. Next slide, please. Some objectives are tracked for specific areas, populations, products, or locations. For example, for TU-1, one of its specific objectives is TU-1.1, reduce cigarette smoking by adults. The 12 leading health indicators are tracked through 26 Healthy People objectives. Healthy People 2020 objectives that are used to track the leading health indicators are noted by this green LHI icon. TU-1.1, reduce cigarette smoking by adults, is one of the 26 objectives used to track the leading health indicators. The baseline establishes the year and benchmark that is used to track progress over the decade and from which the target is set. For objective TU-1.1, the baseline data indicate that 20.6% of adults aged 18 years and older were current cigarette smokers in 2008. The target is what we endeavor to achieve by the year 2020. For this objective, we try to reduce cigarette smoking in adults by 12% by the year 2020. The target setting method identifies the manner by which the 2020 target was set. The target setting method differs from objectives. For TU-1.1, the Healthy People 2010 target was held over to set the 2020 target. The data source identifies the tool used to collect the data. Healthy People 2020 data sources are nationally representative and do not always include local data. When local data are available, they are provided. We're working to add state and local data. In this example, the data come from the National Health Interview Survey. Under more information, one can use one of the hyperlinks to get the objective on the HHS Health Indicators Warehouse, view comparable objectives in Healthy People 2010, and view a structured evidence query developed by the National Library of Medicine, which returns a PubMed literature search. At the Health Indicators Warehouse, users can access more in-depth information. By visiting Data 2010, you can access the comparable objective and its trend data for the past decade. This is also where you'd find any available state or local data. We've partnered with the National Library of Medicine to develop PubMed search strategies intended to support both public health practitioners and researchers in their efforts to achieve Healthy People 2020 objectives. These search strategies search high-quality, peer-reviewed scientific literature to identify research evidence in selected Healthy People 2020 objectives.